What is bowel cancer? Bowel cancer, also known as colorectal cancer, is a type of cancer that begins in the large intestine, colon, or rectum, which are parts of the digestive system. It typically starts as small, non-cancerous growths called polyps on the inner lining of the colon or rectum. Over time, some of these polyps can develop into cancer. Bowel cancer is one of the most common types of cancer, but early detection significantly improves the chances of successful treatment. Types of bowel cancer. 1. Adenocarcinoma. The most common type, arising from glandular cells in the lining of the colon or rectum. 2. Other rare types. Neuroendocrine tumors. Develop from hormone-producing cells. Gastrointestinal stromal tumors. GISTs originate from connective tissue in the bowel wall. Lymphoma. Cancer of the immune system cells in the colon. Symptoms of bowel cancer. Symptoms vary depending on the cancer's location and stage, but may include 1. Changes in bowel habits. Persistent diarrhea or constipation. Changes in stool consistency or shape, e.g., narrower stools. 2. Rectal bleeding. Blood in the stool, which may be bright red or dark. 3. Abdominal discomfort. Cramping, bloating, or pain. 4. Unexplained weight loss. Sudden and significant weight loss without a known cause. 5. Fatigue. Due to anemia from chronic blood loss. 6. Incomplete bowel emptying. Feeling that the bowel does not empty completely. 7. Visible abdominal masses. In advanced cases, a lump may be felt in the abdomen. Causes and risk factors. The exact cause of bowel cancer is not fully understood, but several factors increase the risk. Risk factors. 1. Age. Most cases occur in people over 50. 2. Family history. Having a close relative with bowel cancer increases the risk. 3. Genetic conditions. Inherited syndromes like Lynch syndrome or familial adenomatous polyposis, FAP. 4. Diet and lifestyle. High intake of red or processed meats and low fiber intake. Sedentary lifestyle, obesity, smoking, and alcohol consumption. 5. Inflammatory bowel disease, IBD. Long-term conditions like Crohn's disease or ulcerative colitis. 6. Diabetes, particularly type 2 diabetes. 7. Personal history of polyps. Previous polyps increase the risk of cancer. Diagnosis of bowel cancer. Diagnosing bowel cancer involves several steps. 1. Medical history and physical exam. Reviewing symptoms and family history. Examining for signs like abdominal masses or anemia. 2. Screening tests. Fecal occult blood test, FOBT, or fecal immunochemical test, FIT, detect hidden blood in stool. Colonoscopy. A camera is used to examine the colon and rectum and remove polyps for biopsy. Flexible sigmoidoscopy examines the lower part of the colon. 3. Imaging studies. CT colonography, virtual colonoscopy, produces detailed images of the colon and rectum. CT or MRI scans assess if the cancer has spread. 4. Biopsy. Tissue samples from polyps or suspicious areas are analyzed to confirm the presence of cancer. 5. Blood tests. Carcinoembryonic antigen, CEA, a tumor marker sometimes elevated in bowel cancer. Check for anemia, which may indicate chronic blood loss. Stages of bowel cancer. The stage of bowel cancer describes how far it has spread. 1. Stage 0. Cancer is confined to the innermost lining of the colon or rectum, in situ. 2. Stage I. Cancer has spread to the deeper layers of the colon wall but not beyond. 3. Stage 2. Cancer has grown into or through the outer layers of the colon wall. 4. Stage 3. Cancer has spread to nearby lymph nodes. 5. Stage 4. Cancer has spread to distant organs, such as the liver or lungs, metastasis. Treatment of bowel cancer. Treatment depends on the stage and location of the cancer. 1. Surgery. Polypectomy removes cancerous polyps during a colonoscopy. Colectomy removes part or all of the colon. Nearby lymph nodes are often removed. Colostomy or ileostomy, a stoma, opening in the abdomen, may be created if part of the bowel cannot be reconnected. 2. Chemotherapy. Drugs like 5-fluorouracil, 5-FU, or oxaliplatin are used to kill cancer cells, often used after surgery to reduce recurrence risk or in advanced cases. 3. Radiation therapy. Often used for rectal cancer to shrink tumors before surgery or to kill remaining cancer cells afterward. 4. Targeted therapy. Drugs like bevacizumab or cetuximab target specific molecules involved in cancer growth. 5. Immunotherapy. Used in cases with specific genetic mutations, such as MSH or dMMR tumors. 6. Palliative care. For advanced cases, focuses on relieving symptoms and improving quality of life. Prevention of bowel cancer. 1. Regular screening. Start screening at age 45 to 50, earlier if high risk. 2. Healthy diet. Increase fiber intake and reduce red and processed meats. 3. Physical activity. Regular exercise reduces cancer risk. 4. Avoid smoking and excessive alcohol. Both are associated with higher cancer risk. 5. Maintain a healthy weight. Reduces overall cancer risk. 6. Manage chronic conditions. Treat IBD and monitor for complications. Prognosis and survival rates. Prognosis depends on the cancer stage at diagnosis. Localized cancer, stage I, 90% 5-year survival rate. Cancer with regional spread, stage 3, 70% 5-year survival rate. Distant metastasis, stage 4, 14% 5-year survival rate. Early detection through screening significantly improves outcomes. When to see a doctor. Seek medical attention if you experience persistent changes in bowel habits, blood in the stool or rectal bleeding, unexplained weight loss or fatigue, abdominal pain that doesn't resolve. Early diagnosis and treatment can lead to better outcomes in bowel cancer.